Hi, my name is Brian Carey, VP of Marketing here at Unbound Medicine. Thank you for joining us today for the latest presentation in the Unbound Medicine webinar series, where we'll provide the latest updates on the avian flu. Our presenter today is Dr. Paul Auwaerter, a friend of Unbound Medicine and professor at the Johns Hopkins University School of Medicine. Dr. Auwaerter serves as the clinical director for the Division of Infectious Diseases and Center for Environmental Infectious Diseases. Paul also is a past president for the Infectious Disease Society of America, the IDSA, the largest professional society worldwide related to infectious diseases. We're delighted to have Paul with us today, as he and Unbound work together to deliver the Johns Hopkins Antibiotic Guide for over 10 years, while updating the content every month. So let's get started, shall we? Thanks for joining us, Dr. Auwaerter.
Thanks, Brian. So the topic for this webinar isn't one that we're seeing lots of people in our office, but I thought it might be of some interest and has been a sort of hot topic from time to time. We'll go over some of the recent history regarding avian influenza. For many of you, what you've probably seen stories more so is the price of eggs. And this has often been used as a surrogate to talk about our problems with inflation worldwide, but certainly in the United States, although there have been other aspects as well. And in a way, avian influenza has been one of the components driving this and why it may be out of proportion compared to some of the other food products that you see on this slide. So what's happened over the past 2 years are significant outbreaks of so-called bird flu or avian flu that has been resulting in the deaths or culling of hundreds of millions of birds, both in North America, Europe, and elsewhere in the United States, all in an effort. Sorry, let me back up because you can edit this, I think, right?
Absolutely. Yeah, so feel free to pick up wherever you are, and we'll do that post-production.
Yeah, thanks. So the avian influenza outbreaks have been a real problem for the last 2 years, not only in the United States, but in Europe and other parts of the globe, that over 500 million domesticated poultry have either died or have been culled in an effort to control avian influenza. This is a slide by a agricultural extension that tells you a bit about what happens to the birds if they do get ill. A lot of it is very similar to human disease, although I wouldn't say that we generally get purplish legs or that our wattles are purpley discolored. But as you can see, it's a respiratory and a GI illness, and birds can die rather suddenly. And this is unusual. Sudden death among chickens, for example, is not something that's done by much else. Now, over 20 years ago, I gave a talk about avian influenza, mainly because for the 5 or 6 years preceding the initial outbreak of bird flu in Hong Kong, the first human cases were again uncovered in 2003. And it was actually picked up during the first SARS outbreak at that time, when there was very intensive viral investigations ongoing in Southeast Asia. There were subsequent other outbreaks, not of H5, but other avian influenza strains, including H7 and H9 species and others, again, that occurred not only in Southeast Asia, but also in the Netherlands. And the concern was that this might result in a new strain that would be responsible for a pandemic. So during those couple of years, 100 million or more birds were culled, and a substantial but still small number of people were infected, but the mortality rate was significant. Here at a snapshot in 2005, there was a 55% mortality. And although there was only one human-to-human case, there wasn't really clear evidence of transmission. So this was reassuring, but the worry was the human population has really no immunity to H5 influenza viruses. And although drug at the time did have in vitro activity, oseltamivir, even treatment did not seem to substantially staunch mortality. And there were some efforts at developing a vaccine. So in 2005, this is an old cartoon, but the idea was, were we ready for bird flu? And the answer was probably not, as you can see here by the Katrina reference to Hurricane Katrina and the so-called preparedness for that hurricane and catastrophic event. So where are we now? The avian influenza problem has really been going on for 2 years to a substantial degree. And it's a highly pathogenic avian influenza, and there are different glades. And this one goes by the nomenclature of 2344B, but it is H5N1, and as mentioned, has already affected millions and millions of birds. And just so you're aware, there is a classification system based on the hemagglutinin and neuraminidase components that form the spike of this virus. And there are low pathogenic avian strains and highly pathogenic strains. The low ones really don't cause disease in wild birds and occasionally cause issues in poultry, but it's really the highly pathogenic ones that do cause some disease in birds, but it's rare. But when it gets into flocks, that is really the trouble. And what's happened is the original virus from 1997 has continued to evolve, which is not surprising over the past 25 plus years. And we are now left with this current one that seems to be quite transmissible and problematic. The concern for human disease, we might look back to the pandemic before COVID, and that was H1N1, where there was a recombination. So influenza virus is a segmented DNA genome, and it reassorts, which is why we get a new influenza vaccine every year. But the concern is if it were to mix and produce a novel influenza A strain, mixing components as it did in 2009 with avian and swine components, you would have a new vaccine for which little immunity in the background is made. And indeed, this virus attacked young people more than older populations, completely the opposite of seasonal influenza, because older people actually had some background immunity from decades earlier that was at least sufficient to help mitigate against this infection. So the current avian or so-called bird flu virus can also infect other animals, and that's been seen in a mink farm in Spain and also recovered from sea lions, but it does seem very bird adapted and hasn't yet changed or become highly infectious or transmissible to humans. And the thought is this particular virus is more adapted to the bird temperatures, which run higher than humans and mammals. There has been a child documented with infection in Cambodia recently, and there have been some other viruses recovered from the Nares, but perhaps not thought to represent true infection, as people were not ill. And to date, if you look at the entire universe of H5 bird flu strains, there have been about 900 cases over the past 20 years, but mortality has been substantial in those people. And give you a sense for where this is all occurring, it's hit just about every continent except Australia. You might say, why not Australia? It's because the bird migration routes where birds may not be ill, but still infected, don't go from Southeast Asia to Australia. So they've been spared to date, but pretty much every other continent with bird migration routes have been afflicted with infected flocks and occasional human cases. So control of influenza is controversial. Some countries have been vaccinating their flocks, but others, including the United States and countries in the European Union, are hesitant to take this approach because unless the vaccine is very well matched, it might foster or drive further viral evolution that potentially could elicit unwanted changes. So there are efforts looking at trying to exactly match the circulating virus, and perhaps consideration along those lines rather than one that may be less than perfect. And the risks remain low for acquiring infection, but if you're living with or working with poultry, that seems to be the main risk factor. Interestingly, again, youngsters seem to be more likely to develop this, probably because they've seen less influenza historically in their lifetime, less chances for any kind of pre-existing immunity. And the infection, interestingly, isn't always upper respiratory. And we see this even with seasonal influenza, where some children present with GI predominant presentations, which certainly can occur with bird flu. But of course, the severe disease is pneumonic and can even turn hemorrhagic. Diagnosis is not something you're going to be able to run at your commercial lab or through your hospital, but requires specimens to be sent to your state or local health department and or the Centers for Disease Control for analysis. And if you don't have a respiratory sample, acute and convalescent serologies can be examined as well, again, through your local health department. But basically, anyone that may have traveled, has been working with fowl of any kind, you might suspect avian influenza. And the key seems to be from the existing evidence that early treatment affords the best opportunity to try to help reduce the severity of illness. And at the moment, what's recommended is oseltamivir, which we've had for many years or decades now, the neuraminidase inhibitor that can be taken orally, although there is also a parenteral preparation called peramivir for people that cannot take something by mouth. Some people have used higher dose, but it's not convincing yet that this really has activity. And baloxavir, which has been FDA approved for seasonal influenza, has in vitro activity, but no human experience yet. From a prevention aspect, of course, avoiding exposure to infected flocks is key. If you're handling birds, you may want to avoid or eat certainly only those that are well cooked. Countries have stockpiled oseltamivir, including the United States. And interestingly, if there's an outbreak with requirements for chemoprophylaxis, the advice here is to take it twice daily, not just once daily, which is what's recommended for seasonal influenza, along with other precautions. And there are some efforts at a vaccine. Indeed, a recent story, a news story, has picked up that a number of vaccine manufacturers have already produced and made vaccines against this particular avian influenza virus, and including mRNA technology. WHO has asked that these manufacturers share at least 10% of their vaccine output with low and middle income countries, but the moment it's those with the ability to pay, so wealthier countries, that are subsidizing this effort. And this is something that's in addition to seasonal influenza, but isn't yet organized enough to really pay full heed at the moment. So I think, although we were taken off guard by the coronavirus, I think we've always paid more attention to influenza. Perhaps we'll be a bit more prepared than what could have happened in 2005 if indeed there was a transition and a change such that it became highly transmissible among humans. And I think the mRNA technologies are one that we will be able to look at to quickly turn out a virus in sufficient quantities. So in summary, I'd say that the risk assessment, certainly from the World Health Organization, the CDC, is that avian influenza is, people are at low risk for it, but is worth asking, especially in people who have traveled and may have exposure there. So have a high degree of suspicion and start treatment early and send off samples for analysis. The concern is always with influenza whether it will adapt itself to facilitate transmission and retain pathogenicity. Some vaccines are already under consideration, but the biggest impact is on the poultry industry. I want to take this opportunity to thank you very much for listening to this webinar. I hope it was provide you some useful information, and we always have specific information, including a module on avian influenza in our Johns Hopkins Antibiotic Guide, along with a wealth of other information to help you in taking care of patients. Thanks so much for listening.